Today's date's November 15th, 2018. We're here with Quan. Quan's a Vietnamese native who's been living in this country. He has severe low back pain. He's had 3 surgeries, right?
Yes.
All of them have failed.
Correct.
You have had drugs, epidural injections, everything under the sun, correct?
Correct.
Everything has failed. You even talked about getting a fusion, but the doctor didn't want to do a fusion.
Yes.
So you've come to me, and you told me that your pain will come on in your low back when you sit for a half an hour, and even when you're up standing for a while, correct?
Yes.
Okay. And this pain's been around for 10 years, and you've come to me now to consider ozone injections, right?
Correct.
All right. You were shocked at what I just did. I did muscle testing, correct?
Exactly.
We did kinesiology, and you don't know what happened. Is that right?
Yes. I was like, amazing.
Amazing. Okay. If you recall, I had your arm out like this. That's my hand. And I said, hold. And you were nice and strong.
Yes.
And then I had you touch this tooth right here. And then I said, hold. And I'm just going to take my finger, one finger. Hold.
Oh, it's so heavy. I can't hold.
You can't hold it, right?
Right.
And at first you thought I had to be pushing harder, but you're admitting now I was not pushing harder, right?
Yes.
You cannot hold, and you were really in shock, right?
Yes.
Okay. Thank you. What happened now? You're sweating, you said?
Yeah, I was like feel really sweating just like after a workout.
You were kind of shaken by
Yeah.
what happened to you, weren't you?
Yes, exactly.
Okay, thank you. Now, the only thing we've done at this point is we made an injection of a local anesthetic into number 25. That's that tooth,
Yes.
okay? Something happened to you, wouldn't you say? Something's different?
I believe so.
And also, 2 muscles, your hip muscles got much stronger. Did you notice that?
Yes.
What your leg muscles
Yes.
got much stronger.
Yes.
That came as a surprise. So now you're standing here, and we're going to wait another couple minutes because you said always if you stand for 5 minutes, you would be in serious pain.
Yes.
And the pain would also go down your leg to your bottom of your
Yes.
foot, correct?
Yes.
All right, so we've got 2 more minutes to go.
Something is changing inside my body. So usually if I stand still for 5 minutes, I will be like dead. I cannot stand anymore. I have to lie down to release the pain. But now it seems like 3 minutes or so has passed and I'm still standing, and I feel that both of my feet are still standing strong. I don't know what happened, but that's what I felt.
Okay, so you notice there is something different in your body, but you don't know why because I haven't told you yet, right?
Yes.
Okay.
I just know that I'm still standing, and I feel that I'm standing strong. And that's what I just feeling. I don't know what happened inside my body.
We've got 1 minute to go. Quan, you have been standing in that position, not moving, for already 7 minutes. What is your comment at this point?
I can never do this before. So if I just, before this, if I stand like for 2 or 3 minutes, stand still like this, I already feel so tired and so painful that I have to, move my body so that, it's released the pain
Right.
from the pressure.
And right
That's
now
what I
you're
get.
fine. There's nothing.
I am still standing strong now, which is, I don't remember when was the last time I was able to do this.
Would you have believed this before you came? I didn't touch your back. Would you have believed this?
So I tried to believe that, but I don't expect that it would be cure my problem. But I always, because I'm very open, so I try to open to other solution. And I have watched all the video from different people who has the similar issue or went through even worse surgery, and they fix their issue, and that's why I'm here.
Quan, It's been 10 minutes now.
Yes.
You guaranteed me you would be in terrible pain in 10 minutes, right?
Exactly. Probably 5 or 6.
Probably 5, but we went longer.
Yes, sir.
And when we went 5 and you were in no pain, you said, well, let's go to 10 because it would be 100% guarantee I'd be in pain. So you're up now for 10 minutes, right?
Yes.
And you're fine, correct?
I'm still fine.
Okay. I want the viewer to see now, I haven't told you why I did what I did, correct?
Yes.
Now I'm going to show you.
Sure.
Now you've had acupuncture, you're Asian, so you're familiar with this form of medicine.
Yes.
Please come over here. This is a dental chart, empirical relationships between odontomas, that means teeth, and organs and diseases. Mm-hmm. Your problem here was in this incisor. It's number 25. It says bladder and kidney. Mm-hmm. So this affects the urogenital tract, prostate. But when we come down here, I want you to see which spinal segments are involved. What's that say? L2, L3, sacral, as well as coccyx. So you had, and this is why I take the history that I do and try to get a dental history, and I had to extract it out of you because you weren't forthcoming with it. You told me that you had a problem in this tooth. It's genetic, and we can see it. It's black on either side of it. And you told me that that tooth, genetic or whatever, was lost.
Yes.
And now it's a fake tooth.
Yes.
So all I did was want to check you by injecting a local anesthetic into that energy field, which is basically an acupuncture meridian, because that tooth is connected to the kidney bladder meridian. And the kidney meridian goes to the bottom of the foot.
Okay.
Right where your pain is. Mm-hmm. Am I making sense?
Yes.
So if that tooth is screwing up your kidney meridian, then it could cause pain and dysfunction anywhere along that meridian.
Okay.
It's also kidney bladder meridian. The kidney bladder controls bones, and it basically controls the entire spine. But in particular, the bladder meridian runs down your back right along here and right over the sacral area. Am I making sense?
Yes.
And that tooth can be screwing up that entire meridian system. That's why I did that first, and you were expecting me to shoot up your low back and your neck with needles and ozone, right?
Right.
And look what we've done so far. Turn your head to the right, please, as far as you can. More. Wow. And turn it to the left, please, as far as you can. Okay? There's a difference, is there not?
I think so.
Okay. And your low back is doing fine. You've been standing up now for almost 15 minutes.
I can't believe it.
Okay.
I can never stand this long.
Okay.
Before.
And I didn't touch your back and I didn't touch your neck.
Right.
All right. So I'm going to talk to you for a few minutes about where to go at this point.
Okay. So right now I'm starting to feel that my lower back pain, I feel like from 1 to 10, I start to feel like I have a pain of the 1 level. But if it was like before, this would be like 13 out of 10.
13 on 10.
Yeah.
Okay, I love it. Quan, you've had surgery after surgery, 3 surgeries, epidurals, everything under the sun. And you flew up here from Los Angeles.
Correct.
If your problem is coming from number 25, and the viewer can see that little blackness on either side of the base, if it's coming from that, nothing in the world is going to do you much good until that's fixed.
Exactly.
Do you understand?
Exactly.
So you had these surgeries one after another, and in my opinion, right now, in my opinion, I could be wrong, they were waste. And
I thought so too.
And they put you at risk because the source of the problem, the cause of the problem, was not addressed.
Exactly.
Now, they've given you drugs too for pain, is that true?
Yes.
What did they give you?
They gave me like painkiller, like oxycodone.
Oxycontin, people are addicted to that. What
Yeah.
else?
So, but what I do not try to take it regularly. I only take like one or two once in a while when I really need some energy to do something.
Exactly, but they still gave you a narcotic.
Yes.
And they've given you NSAID, non-steroidal
Yes.
anti-inflammatory drugs,
Yes.
right?
Yes.
Okay, so this is a good point to show that there's a cause for these things, and maybe taking drugs isn't the answer.
Right.
Let's find the cause, and even surgery might not be the answer.
Right.
May I post you on YouTube?
Sure, definitely.
Thank you, and I'm going to wait until we get the dental report back.
Sure.
Thank you.
You're
And for
welcome.
the viewer, we ended up doing Prolozone on your neck and back, but that's only mainly because you're here and you're from 400 miles away.
Yes.
The main point right now is to get to tooth number 25, or
Correct.
the socket. Thank you.